Okay, Rheumatoid Arthritis Video 5, Treatments. This is the last video in this lecture series. Various treatment options for rheumatoid arthritis, including side effect of medications when caring for persons with rheumatoid arthritis, is going to be discussed. So in the initial part of rheumatoid arthritis lecture series, I had explained the pathophysiology of rheumatoid arthritis using the same diagram from Davidson textbook of medicine. I won't be going through this diagram again, but just to highlight some important points. In the right genetic predisposition and the environmental triggers, some of the proteins in the body get modified, they become immunogenic. The immune system recognizes them now as foreign, and then they produce T cells proliferate and produce TNF alpha, which is a main driver of inflammation, and B cells proliferate and get activated, produce plasma cells, and cause antibody production and cause rheumatoid factor and ACPA antibodies. There are some treatments that can decrease the acute inflammation. They are used as bridge therapies. They are symptomatic therapies to reduce pain and inflammation. And they are NSAIDs and steroids. As you know, NSAIDs and steroids inhibit prostaglandins and therefore reduce pain and vasodilatation. The other therapies that are used will be discussed later, but let's come back to the symptomatic management of rheumatoid arthritis, that being corticosteroids and NSAIDs. You see over here, corticosteroids inhibit phospholipases A2 and NSAIDs inhibit COX-1 and COX-2 enzymes, which in turn decrease inflammation and pain, and therefore is a great symptomatic relief. So now let us talk about common rheumatoid arthritis treatments. Let's start by talking about non-steroidal anti-inflammatory agents. They don't modify the damage, or they don't prevent the damage that will be caused by rheumatoid arthritis. They are just a bridge till the actual therapy starts acting. NSAIDs basically are bridge therapy. You can either use naproxen, ibuprofen, diclofenac, meloxicam, or celecoxib. Again, remember it has to be used for a short duration till the more potent drugs can start acting. The other bridge therapy is steroids. You can use oral prednisone or prednisolone, or you can use depomedrol, that is intramuscular, or depomedrol or triamcinolone intra-articular steroids. They are helpful for calming the flares. They can be injected into the joints for quick relief, but best used only for short term because they can have a lot of side effects, including heartburn, poor bone health, mania or depression. They could give rise to weight gain. They could give rise to high blood sugar and high blood pressures. Now, these are some of the common rheumatoid arthritis treatments that should be kept in mind. So when you diagnose a person with rheumatoid arthritis, you initially try to decrease inflammation burden by giving bridge therapy. That would be NSAIDs and or prednisone. At the same time, you start DMARDs. DMARDs are disease-modifying anti-rheumatic drugs, which are usually the first line of treatment. So you can start with methotrexate or leflunomide or sulfasalazine or hydroxychloroquine. Methotrexate is the most commonly used rheumatoid arthritis treatment. It can cause alopecia or oral ulcers or elevated liver enzymes as a side effect. So it has to be taken with a medication known as folic acid to prevent alopecia and oral ulcers. Some of the other common rheumatoid arthritis treatments are known as biologics. If the DMARDs, those medications that I mentioned earlier, methotrexate, hydroxychloroquine, sulfasalazine, and leflunomide, if those medications fail, then the next set of medications to be used are called as biologic. They are the fancy drugs in rheumatoid arthritis, and they prevent the progression of rheumatoid arthritis. So these drugs are great. There are some medications that prevent TNF-alpha, like Humira, Enbrel, Remicade. There are some medications that prevent autoantibody formation called rituximab. Some other medications inhibit other interleukin 1 and 6, anakinra and tocilizumab. Now remember, I don't want you to get stuck on the names of the medications. I just wanted you to understand the concepts. For your tests, please remember NSAIDs and steroids are bridge therapy, and methotrexate is the first line agent, and there are some biologic medications in case the first line agents fail. With that, I want you to go back to our case. Our same 39-year-old Asian female, now her blood tests are back that showed elevated ESR and a positive rheumatoid factor and ACPA. You diagnose her with rheumatoid arthritis and she says, "I'm so worried. I do not want to end up crippled on a wheelchair like my aunt and who had really bad rheumatoid arthritis. Can you cure my arthritis?" At this stage, I want you to pause the video, take your pen and paper and jot down a few lines on how you would counsel this patient. After you're done, hit play. This is how I may choose to answer this patient. Using newer powerful medications, we can effectively halt the progression of rheumatoid arthritis. I will send you to a rheumatologist to discuss those medications. In the interim, let's start you on some low-dose prednisone to help you with your pain, swelling, and stiffness. So what are some of the take-home points from this lecture? You can use NSAIDs or steroids as bridge therapy. DMARDs such as methotrexate are first-line agents, and if those fail, biologics are the newest kids on the block to treat rheumatoid arthritis. They are very powerful and they slow the progression of rheumatoid arthritis. And again, don't forget to post a question or a comment using the QR code. Thank you so much and have a good day.